Hello, my name is Dr. Denny and welcome to the Antalgic-Trak training series. We will now do a demonstration on the touchscreen navigation.
This demonstration will show how we set our parameters for a lumbar decompression. The patient has been strapped in, their belts are secure, and once the positioning is appropriate, we go to our touch screen and I'm going to press our lumbar therapy button. I have a choice between setting it up by force or poundage or by stroke and distance. I will use the force and poundage setup. So I just touch that button and we have a lumbar force setup screen. The first thing I want to do with this screen is I want to clear the last session. So I'm starting with fresh parameters. I'm going to now begin to lower the seat bottom, which is how the poundage starts to register on the machine. There you see the seat bottom lowering. I've got 60 pounds, 59 pounds of pull. I'm going to lower a little bit more, and then I'm going to teach that 66 pounds. I'm going to now raise the seat to release some of the poundage, but I do want to keep a few pounds on. I'll teach that. Then I'm going to go into my standard therapy screen. I'm going to set for demonstration purposes a 2-minute session. The lumbar sessions in general typically can go from 20 minutes to 40 minutes, but you might adjust that more or less depending on the patient's needs. Also, for demonstration purposes, we have a dwell time setting, and what that means is when we pull the patient or decompress the patient, how long do we want to hold that poundage? So for demonstration purposes again, we're going to decompress this patient's spine for 3 seconds, and then we're going to release it for 3 seconds. Typical dwell time settings can be 2 to 1, 20 seconds pull, 10 seconds rest, or 30 seconds pull, 15 rest. Many times we'll use between 30 and 40 seconds with a 10-second rest. That seems to work for many of our patients. So I'll hit the start button. The machine will calculate the time, and as you can see, it's beginning to pull the patient and release the patient. I'm going to go up to 4 seconds of pull with a 2-second release, just so you can get an idea of how the machine will pull and release. Once again, typical settings for a normal session could be 30 seconds pull, 15 or 10 seconds rest. Poundage might be anywhere from 75 to 150 pounds of pull with a release of 50 to 60% of that weight. At the end of the session, a bell will trigger. The machine will stop itself wherever it is in the cycling. It will finish its last cycle, and then it will come back to the release setting. Here I'm coming in. I'm going to stop the session. It says cycle stop initiated. Now the machine is finished. I will raise the seat a few millimeters just to release the pressure, and then we want to disconnect the harnessing, so we have the patient move their arms out of the way. We're going to push the barrel lock, slide the belt through, push the barrel lock, slide the belt through. Then we release the front anterior straps, and the patient is ready to come up off the machine and off for finish their first session. Then I lower the seat, to make it a little easier for the patient to come off the machine. And it's nice to hold the patient's hand, help them rotate, and step off. And that concludes a lumbar treatment session.